Welcome to this Step 2 clinical knowledge review on immunization test-taking strategies. This video is brought to you by Roadmap to Residency. Today, we are going to break down the most common question patterns you will see on your board exam for immunizations, including the adult immunization schedule, travel vaccines, immunocompromised patients, and vaccine hesitancy counseling. The goal here is not to reteach the entire topic, but to help you recognize patterns and apply test-taking strategies. Make sure you have reviewed the preventive medicine and infectious disease sections of first aid and your question bank before or alongside this video. Here is what we will cover in this video. First, we will learn to recognize high-yield question stems for adult immunizations, travel vaccines, and immunocompromised patient vaccination. Second, we will apply test-taking strategies for vaccine schedule questions, travel medicine scenarios, and vaccine hesitancy counseling. Third, we will master the common question formats you will encounter on exam day. Before we jump in, remember this video assumes you have already reviewed the preventive medicine and infectious disease chapters in first aid and your question bank. We are here to sharpen your test-taking skills, not replace those foundational resources. Our first strategy is what I call the age-based vaccine split. When you see an immunization question, the very first thing you should do is identify the patient's age. This immediately narrows your answer choices. For younger adults, think about completing the human papillomavirus vaccine series and making sure they have had their tetanus booster. For older adults, especially those 65 and above, think pneumococcal vaccines and the recombinant zoster vaccine. The boards love testing these age cutoffs, so train yourself to look at the age in the stem first, then work from there. Review the adult immunization schedule table in first aid for the exact age ranges. Strategy 2 is knowing your live versus inactivated vaccine rules. This is probably the single highest yield concept for immunization questions. The board loves to give you a patient who is pregnant, on chemotherapy, or post-transplant, and then ask which vaccine is appropriate. Your job is to immediately eliminate all live vaccines from the answer choices. Live vaccines include measles, mumps, rubella, varicella, the nasal spray influenza vaccine, and yellow fever. Inactivated vaccines are safe for immunocompromised patients and pregnant women. A classic board trap is offering the old live zoster vaccine for an immunocompromised patient. The correct answer is always the recombinant zoster vaccine because it is not live. Review the immunocompromised vaccination guidelines in your board resources for the complete list. Now let us talk about recognizing high-yield question stems. There are 3 main patterns you will encounter. First is the travel vaccine stem. The board will give you a patient traveling to a specific region and ask what vaccines they need. Your job is to match the destination to the vaccine. Yellow fever for sub-Saharan Africa and South America, hepatitis A and typhoid for most developing regions, and meningococcal vaccine for the meningitis belt of Africa. Second is the immunocompromised patient stem. Anytime you see a patient on immunosuppressive therapy, your immediate reflex should be to eliminate live vaccines from the choices. Third is the vaccine hesitancy stem. These questions test your communication skills. The correct answer is always the one that shows empathy first and evidence second. Review the travel medicine and immunocompromised vaccination sections of your board resources for these patterns. Let us walk through our first practice question. Read through this carefully. We have a 55-year-old kidney transplant recipient on immunosuppressive medications who wants the shingles vaccine. Before I reveal the answer, think about our strategy. What is the first thing you should identify? This patient is immunocompromised. That means we need to immediately think about which vaccines are live and which are inactivated. Take a moment to think about which answer you would choose before we move to the next slide. Here is the answer walkthrough. Step 1, spot the pattern. We have a transplant recipient on immunosuppression. This immediately tells us we are dealing with a live versus inactivated vaccine question. Step 2, apply the rule. The recombinant zoster vaccine is an inactivated recombinant adjuvanted vaccine. It is not live, therefore it is safe to give to immunocompromised patients. Step 3, eliminate wrong answers. Choice A is the live zoster vaccine, which is contraindicated. Choice C is too absolute because inactivated vaccines are perfectly safe in transplant recipients. Choice D suggests deferring, but transplant patients typically remain on immunosuppression for life, so we do not wait. The correct answer is B, administer the recombinant zoster vaccine. This is a classic board question format. so make sure you know your live versus inactivated list cold. Here is our second practice question. We have a healthy 32-year-old woman traveling to rural sub-Saharan Africa for a medical mission. She needs travel vaccines and leaves in 3 weeks. Think carefully about the destination. Sub-Saharan Africa is the key clue here. Which vaccine would be most critical for this region? Consider which diseases are endemic to this area and which vaccines might actually be required for entry. Take a moment to think through your answer before we continue. Let us break down this answer. The key strategy here is matching the destination to the vaccine. When you see sub-Saharan Africa, your reflex should be yellow fever. Many countries in this region require an international certificate of vaccination for yellow fever before they allow entry. Japanese encephalitis vaccine is for rural Asia, especially prolonged stays with rice paddies and pig farming areas, so that is a distractor. Cholera vaccine is rarely recommended or tested. Rabies pre-exposure prophylaxis would be reasonable for someone with high animal contact risk, but it is not the most important vaccine for this scenario. Also remember that yellow fever vaccine must be given at least 10 days before departure to count. The correct answer is B, yellow fever vaccine. Review the travel vaccine destination table in your board resources to solidify these associations. Now let us talk about vaccine hesitancy questions. These are becoming increasingly common on the boards. The key principle is that the correct answer always uses empathetic, patient-centered communication. The boards want to see that you can build rapport with a hesitant patient. You will typically see a parent who is worried about a childhood vaccine, or an adult who has read something concerning online. The wrong answers will be dismissive, authoritarian, or paternalistic. The correct answer acknowledges the concern, asks permission to share information, and provides evidence-based facts without being confrontational. Think of it as motivational interviewing applied to vaccination. Review the communication and ethics sections of your board resources for more on this approach. Here is our third practice question. This is a classic vaccine hesitancy scenario. A mother is concerned about the human papillomavirus vaccine based on something she read online. Notice how each answer choice represents a different communication style. Think about which approach uses empathetic, patient-centered communication. Which answer validates her concern while also opening the door to share evidence-based information? Take a moment to consider your answer. Let us walk through this answer. The pattern to spot here is the communication style. On every vaccine hesitancy question, the correct answer has 2 components. First, it validates the patient or parent's concern. Second, it asks permission to share evidence. Choice A does both. It says, "I understand your concerns," which validates, and then asks, "Would it be okay if I shared some information?" which asks permission. Choice B is wrong, because the human papillomavirus vaccine is recommended, not legally mandated in most places. Choice C is wrong because telling a patient they are wrong is dismissive and breaks rapport. Choice D is wrong because threatening to end the patient relationship over a vaccine refusal is unethical. The answer is A. Remember, the boards are testing your communication skills, not just your medical knowledge. This same framework applies to any patient who refuses a recommended intervention. Here is a critical test-taking pearl about pneumococcal vaccination. The boards love to test whether you know who qualifies for pneumococcal vaccines. The 2 main groups are adults aged 65 and older, and younger adults with specific risk factors. Those risk factors include chronic heart disease, chronic lung disease, diabetes, alcoholism, chronic liver disease, cigarette smoking, cerebrospinal fluid leak, cochlear implant, and immunocompromising conditions. On the exam, they will present a 50-year-old smoker with diabetes and ask if pneumococcal vaccination is indicated. The answer is yes. The specific vaccine products and sequence recommendations have changed over time, so focus on knowing who qualifies rather than memorizing brand names. Check your board resources for the current recommendations. This is a high-yield topic that appears on almost every exam. That wraps up our immunization test-taking strategies review. Let us recap the key takeaways. First, always identify the patient's age to narrow your vaccine choices. Second, know your live versus inactivated vaccine list, because this drives almost every immunocompromised patient question. Third, match travel destinations to their required and recommended vaccines. And fourth, on vaccine hesitancy questions, always choose the empathetic, permission-based counseling response. For deeper review, go through the preventive medicine and infectious disease chapters in first aid and work through the immunization questions in your question bank. If you found this video helpful, please like and subscribe to our channel for more board review content. And if you want personalized tutoring or residency application guidance, visit our expert tutors and residency advisors at roadmaptoresidency.com. Good luck on your exam, and we will see you in the next video.